Hey guys, what's going on? My name's Max and I'm a fat loss expert, which basically means that I help people lose weight, fit their clothes better, and feel more comfortable in their own skin. In today's video, I will be talking about osteoporosis and what we can do to improve osteopenia and osteoporosis. This video is a little off topic from what I usually make my videos about, but one of my clients requested for me to make a video about this and I feel like it could really help her a lot, and it may help you as well. First of all, in case you don't already know, osteoporosis is a condition in which bones become weak and brittle. This can lead to a number of different problems. One of the biggest is hip fractures, and the worst part about this is that a hip fracture caused by osteoporosis many times can be a death sentence because it's very hard to recover from. The statistics for this nasty condition are actually pretty high. 1 out of 2 females will get osteopenia or osteoporosis. Osteopenia is the precursor to osteoporosis. It's when bone density starts to go down. And roughly 1 in 5 males will get osteopenia or osteoporosis. There are many reasons why somebody would lose bone density. Number 1 factor is aging and a sedentary lifestyle. So we all know the term, if you don't use it, you lose it, and this applies to our bones as well. If we're not using our bones, we're going to lose them. So being sedentary and not exercising many times will lead you to lose bone density, and eventually it turns into osteoporosis. The next thing that could lead you towards osteoporosis is a poor diet. So it's very important that we're having proper nutrients and that those proper nutrients are getting absorbed. It's not only about consuming those nutrients through a pill or even through your food, it's also about consuming other nutrients that will help you absorb calcium, for example. And another thing that we see a lot is people on blood thinners or anti-inflammatory medication. They have a decrease in bone density as well. So now that I've probably scared the shit out of you, let's get to some solutions for this problem. One of the best solutions is to eat more green vegetables. I always recommend in my videos for you to have an unlimited amount of green vegetables in your diet, but it could never be more true than it is right now for this particular condition. It's been shown that green leafy vegetables are very helpful with reversing osteopenia and osteoporosis. I recommend a minimum of 5 cups of vegetables per day. That'll really help you get all the nutrients and the minerals that you need to absorb more calcium. Remember to keep these veggies limited to the green leafy vegetables. Those are the best for calcium and decreasing osteoporosis. Vegetables are alkaline in nature, so they're going to decrease the acidity and inflammation throughout your body. This is going to be done naturally as opposed to any kind of anti-inflammatories that you may be taking right now. Milk and dairy products in general have been linked to increasing your bone density because they are high in calcium. However, lately it's been discovered that just because something is high in calcium doesn't mean that your body's absorbing that calcium. Certain plant-based products are also high in calcium, however, they're a lot easier for your body to absorb and use. Beans, nuts, and green leafy vegetables are the best to absorb calcium for your body. So make sure that you up those in your diet. Also, omega-3 was linked to absorption of calcium, so make sure that you increase the amount of omega-3 in your diet. The right amount of calcium that's necessary for somebody to have healthy bones is up for debate, but if you want a number, many doctors recommend that you get anywhere from 1,000 to roughly 1,300 milligrams of calcium per day. Now that I've told you all the easy stuff that all of the lazy, sedentary people can do, this works 100% of the time, and it's way more effective than almost anything that I've already suggested. And that crazy thing is called exercise. Now, many doctors believe that walking or running will help increase bone density, but I don't think that this is going to get you guys the results that you guys want. Having extra weight on your bones, muscles, and joints is not only beneficial for you during exercise, but also necessary for you to prevent things like osteopenia and osteoporosis. Again, if you don't use it, you're going to lose it. Really, any kind of weight training is going to be beneficial for your osteoporosis. However, many people with osteoporosis do have other problems with their posture. They have many postural deviations. So we want to make sure that we correct any kind of postural deviation before we start training with weights and going hard in the gym. I actually already made a video about how you can improve certain types of postural deviations that you could check out right over here. If you haven't exercised in 30 years and you're going to go and start doing push-ups on the ground, you might hurt yourself. You might be better off doing a wall push-up at first and taking it really slow and easy. Start off slow and increase and progress as you go. If you're just going to be squatting your body weight every single week, yes, that'll improve your bone density, but it'll cap off at a certain point because there's no more reason for your body to grow and improve. When you're ready, up your weight and challenge yourself with harder weight-bearing exercises. That's all I got for you guys today. If you guys enjoyed this video, please subscribe to my channel where you could view other videos and tips like this one. If you have any questions for me or would like to work with me directly one-on-one, you could train with me online by visiting my website. Thanks for tuning in, guys. I'll see you guys next time.